Our team are mainly the students of nursing. Therefore, we focus on the impact of generative AI in nurse and radiographers.
Generative artificial intelligence has the potential to revolutionize healthcare and healthcare workers, including nurses and radiographers, which play vital roles in providing care and holistic health improvement for patients. As Gen AI advances, its impact on these industries becomes increasingly significant. Our project aims to explore the profound implications of Gen AI on nursing, including the automation of routine tasks and decision-making based on big data analytics, and regarding radiographers aiding in diagnosis and treatment through pattern recognition. Understanding these implications provides insights into the evolving healthcare landscape, as well as how AI can assist healthcare.
First, nurses can assess a wealth of information on comorbidity from AI through automation assessments. It allows them to identify common patterns, prevalence, and associated risk factors. Throughout the day and night, AI-powered devices monitor vital signs such as blood pressure and oxygen saturation round the clock. This helps nurses identify potential risk or deterioration of patient condition properly. It can reduce the workload and errors of nurses who have to manually review and document patient information. To further support nurses in making informed decisions, an AI-powered clinical decision support system is introduced. DSS leverage big data analytics and provide real-time decision support to junior nurses. The CDSS generates evidence-based treatment recommendations tailored to each patient's unique comorbidities. This can enhance the nurse's clinical reasoning and judgment, as well as reduce error and variability in care delivery. Besides, AI-powered chatbots can be designed as personal medicine advisor in the form of an app. It possesses the capability to fulfill the demands of patients by facilitating interactive dialogue and providing assistance, inquiry resolution, and promotional support. Referred to as generative AI, these technological advancements effective response to patients' needs, thereby yielding improvements in healthcare efficiency and ensure the provision of prompt response and support to the patients. The use of AI in nursing practice offers the opportunity to stimulate diverse medical conditions and response through virtual patients. For instance, virtual reality platforms and AI-powered stimulation allows nurses to interact with virtual patients inhabiting different medical conditions and response. AI provides real-time feedback and guidance, enhancing the learning process and improving patient care outcomes.
The aforementioned discussion sheds light on the impacts of AI within the nursing profession. Moving forward, our analysis will focus on the contributions of AI to the field of radiograph, specifically to the domain of diagnosis and treatment. One of the ways that Gen AI can help diagnosis in the radiographers industry is by improving the patient positioning and image analysis process. Gen AI can compare the current positioning images with the reference image taken during the planning stage and guide the positioning of the patient. Patient positioning is a crucial step in radiation therapy, as Gen AI can help to ensure that the radiation beam is accurately targeted to the tumor and minimize exposure to healthy tissue. This can reduce the time and effort required by the therapist and increase the precision and consistency of the treatment. Image analysis is another important aspect of diagnosis, as it involves the detection and interpretation of medical images. Machine learning algorithms can be trained to analyze patterns and anomalies in medical images. Gen AI can be used to detect and highlight tumors in the early stages. provide a high degree of accuracy, speed up the process, and reduce the chances of human error. These benefits can enhance the quality and reliability of the diagnosis and facilitate better decision-making by the radiologist. Another way that GenAI can help treatment in the radiography industry is providing personalized and optimized radiation dose plans for each patient. GenAI can analyze a vast amount of data, including medical images, patient's medical history, and genetic information, to determine the optimal radiation dose and suggest the best angle to deliver the radiation. This can ensure maximum effectiveness and minimize harm to healthy tissues. In summary, GenAI can assist the radiographers to improve the safety and effectiveness of the treatment throughout the process of both diagnosis and treatment.
In our project, we apply different AI tools, such as the GPT-4 and Canva. There is the sample of our AI prompts and the reply.
GPT-4 provided us with many samples, but we noticed a few shortcomings. Firstly, it lacked explanations for how AI could assist nurses and radiographers, which made it difficult for us to understand the reasoning behind the generated text. Additionally, we found that the ideas in the generated samples were disorganized and lacked connectivity between points. This repetitiveness made it challenging to extract coherent information from the text. Another issue we encountered was that GPT-4 tends to over-explain common knowledge. This verbosity made the generated text unnecessarily long and redundant. Now, let's move on to the challenges we faced while using stock images generated by Canva. One problem we noticed that was the presence of the uncanny valley effect on some of the human faces in the photos. This distortion made the images appear unnatural. We also came across instances where the generated images had extra limbs or fingers. These mistakes, although not affecting the main points of our presentation, would distract the audience and will make the overall presentation seem sloppy and unfinished.
Let's begin by delving into the problem-solving techniques used for text generation. The first strategy is to proofread the resources provided by the AI in order to catch any mistakes and make necessary adjustments. Another technique is to adjust the sentence ourselves. We can refine the output to meet our desired standards. Additionally, rewriting the poem can yield better results. By refining and providing more specific instructions, we can influence the output to align with our requirements. Lastly, refine information independently when the response is still not ideal. Now let's move on to the problem-solving technique employed in image generation. First and foremost, we can rewrite the poem in more detail, such as specific attributes or characteristics, to guide the AI model to generate images that better align with our requirements. Another approach is to generate multiple images and carefully review them. By exploring different options, we can select the most suitable image that meets our need.
In conclusion, the incorporation of AI technology in nursing practice presents a multitude of advantages. The implementation of AI automation in assessments reduces the workload and minimizes errors. The clinical decision support systems offer evidence-based recommendations to clinical reasoning. Furthermore, in the field of radiographers, personalized analysis facilitates maximum effectiveness. These advancements ensure the quality and safety by optimizing radiation dosage. By embracing generative AI, healthcare endeavors promise enhanced efficiency, decision-making, and patient outcomes. During our group project, we employ different generative AI tools to enhance our efficiencies. These tools were utilized for brainstorming examples, elaborating on arguments, and generating contents. However, we encounter several challenges. The AI-generated outputs are repetitive, verbose, and lacking incoherence. To address these issues, we apply different processes such as proofreading, regeneration, and adjustment. which enable us to rectify the problem and enhance the overall connectivity and quality of the generated contents. This is the end of our project. Thanks for watching.